Level 1, the pre-med student. You're in college, biology major, pre-med track. You're taking organic chemistry, physics, biochemistry, calculus. You're competing against everyone for limited medical school spots. You need a 4.0 GPA, perfect MCAT score, research experience, volunteer hours. You study 80 hours a week. You have no social life. While your friends are partying, you're in the library. You volunteer at a hospital. You shadow doctors. You're building your resume, your application, your future. You take the MCAT, Medical College Admission Test, 8 hours. You score in the 98th percentile, top 2%. You apply to 20 medical schools. Each application costs money. Primary applications, secondary applications, interview travel. You spend $10,000 just applying. You get 5 interviews. You travel across the country. You wear your suit. You answer their questions. You sell yourself. 3 months later, you get an acceptance. 1 school. You're going to medical school. Your life just changed. You're also about to go $300,000 into debt. Level 2, the medical student. Medical school, 4 years, no income, only debt. You take out loans, tuition, living expenses, books. First year, basic sciences, anatomy, physiology, pathology. You're in class 8 hours a day. You study 6 more hours at night. You dissect a cadaver, your first dead body. You name her. You learn every structure, every nerve, every vessel. You're desensitized quickly. It's not a person anymore, it's anatomy. That's how you cope. That's how everyone copes. Second year, more classes, pharmacology, microbiology, immunology. You take step 1, the first medical licensing exam. This test determines your future, your specialty, your residency. You study 12 hours a day for 8 weeks. You pass, high score. You're competitive for good residencies. Third year, clinical rotations. You're in the hospital now. Surgery, internal medicine, pediatrics, psychiatry, OB/GYN. You work 80-hour weeks for no pay. You're still a student. You're the lowest person in the hospital. Everyone orders you around. You see your first patient die. Elderly woman, stroke. The attending pulls the plug. You watch her vitals drop to 0. You go home that night. You don't cry. You don't feel anything. You're exhausted. You're numb. You're becoming a doctor. Fourth year, applications again. Residency, your specialty. You want emergency medicine, fast-paced, procedures, variety. Match day. You open an envelope. It tells you where you'll train. New York, a level 1 trauma center. You matched. You're done with medical school. You're $250,000 in debt. You still haven't earned a paycheck. You're 26 years old.
Level 3, the intern. Residency, year 1. You're an intern, first-year resident. You're finally getting paid, $60,000 a year, but you're working 80 to 100 hours per week. That's $12 an hour, less than minimum wage in some states. Your first shift in the emergency department. You're terrified. You're responsible for actual patients with actual diseases. Your first chest pain. Could be a heart attack. Could be anxiety. You order an EKG, troponins, chest x-ray. Your attending reviews your plan. Good, but also order a D-dimer. You missed something. You're learning. Fast. Your first trauma. Motorcycle accident. The patient is coding. You start CPR, your attending intubates, the nurses push drugs. The patient dies. On your table, in your emergency room. You pronounce the time of death. You notify the family. You tell them their 20-year-old son is dead. The mother collapses. The father just stares, silent. You go back to seeing patients. A sore throat, a sprained ankle, a rash. You don't have time to process what just happened. You work 30-hour shifts, admitting patients all night. By hour 28, you're hallucinating, making mistakes. You accidentally order the wrong medication. Your senior catches it. Pay attention. That could have killed the patient. You're so tired you can barely think, but you keep working. because that's what doctors do. You miss holidays, birthdays, your grandmother's funeral, you're in the hospital, always. Level 4, the senior resident. Year 3 of residency. You're a senior now. You supervise interns. You handle complex cases. You're trusted. You respond to a trauma activation, gunshot wound, chest. The patient is bleeding out. You have minutes. You intubate, you place a chest tube, you start massive transfusion. You're doing procedures you've only practiced under pressure. The trauma surgeon arrives, takes over, stabilizes the patient. The patient survives. You helped save a life. But the next trauma doesn't go well. Stabbing, multiple wounds. You do everything right. The patient dies anyway. You're learning the hardest lesson. Medicine has limits. You can't save everyone, no matter how hard you try. You work a pediatric code, 3-year-old, drowning. You do CPR for 40 minutes. The child doesn't come back. You tell the parents, the worst conversation you'll ever have. You watch them fall apart. You stay professional. You don't cry. You cry later, in the break room, where no one can see. You're making $65,000 a year, year 3 of residency. You're still $200,000 in debt. Your medical school friends are making twice what you make. They went into dermatology, radiology, ophthalmology. Better hours, better pay. You chose emergency medicine. You chose the chaos.
Level 5, the chief resident. Final year of residency. You're chief resident. You manage the department, schedule residents, handle conflicts. You're also still seeing patients, still working nights, still exhausted. You see a patient with abdominal pain. Seems simple. Probably gastritis. You send her home with antacids. Follow up with primary care. She comes back 6 hours later. Worse. Much worse. Ruptured appendix, septic, ending to the OR emergently. You missed it. You almost killed someone. The attending sits you down. This happens. Learned from it. Move on. But you can't move on. You replay it constantly. What did you miss? What could you have done differently? You develop anxiety, imposter syndrome. What if you're not good enough? What if you hurt someone again? You see a therapist, finally, after 3 years of residency. You're diagnosed with depression and burnout. You're not alone. 50% of residents have it. Medicine doesn't talk about it, but everyone suffers. You finish residency. You're board certified now. You're finally a real doctor, an attending physician. You're 32 years old. You've been in school for 14 years. You're ready to start your career. Finally. Level 6, the attending physician. Your first job, emergency medicine attending, level 1 trauma center. You're making $250,000 a year. After taxes and loan payments, you take home less than you think. But you're in charge now. You make the final decisions. You supervise residents. You see complex cases. You save lives. You work 12-hour shifts, 10 to 12 shifts per month. Better than residency, but still demanding. You see everything: heart attacks, strokes, traumas, overdoses, mental health crises, chronic pain, drug-seeking behavior. You learn to spot the patterns, the manipulations, the lies. You become cynical. It's a defense mechanism. A patient overdoses, heroin. You give naloxone. He wakes up. He's angry, yelling, "You ruined my high." You just saved his life. He doesn't care. You see the same patient 3 more times that month. Same overdose, same outcome. The cycle doesn't break. You treat a domestic violence victim. Broken ribs, black eyes. She won't press charges. She goes back to him. You feel helpless. You can fix the injuries. You can't fix the situation. You work a mass casualty incident, nightclub shooting, 15 victims. You're triaging, deciding who gets resources, who lives, who dies. You save 12, 3 don't make it. The news calls you a hero. You don't feel like one. You're divorced now. Your first marriage. Couldn't handle the schedule, the missed anniversaries, the emotional distance. You're 35, making good money, completely burned out. Level 7, the medical director. 10 years as an attending. You're promoted to medical director. You oversee the emergency department, 30 physicians, protocols, quality. You're not just seeing patients, you're managing a department. Physician conflicts, nurse complaints, administration demands. You implement new protocols, sepsis screening, stroke care, trauma systems. You're improving patient outcomes, making a difference. But you're also dealing with politics, hospital administration. They want faster patient throughput, lower costs, higher satisfaction scores. They don't care about quality, they care about metrics. You fight constantly for your staff, for your patients. A physician on your staff makes a mistake, misses a diagnosis. The patient sues, the hospital settles. You have to discipline the doctor. She's your friend, you train together, but policy is policy. You lose a physician to suicide, burnout, depression. He couldn't cope. You attend the funeral, you give a speech, you blame yourself. Could you have seen the signs? Could you have helped? You implement wellness programs, peer support, mental health resources. But the culture doesn't change. Doctors don't ask for help. Asking for help means weakness. You're making $350,000 a year. You're also on your second divorce. The job consumed everything again. Level 8, the Chief Medical Officer. 15 years in, you're appointed Chief Medical Officer. You oversee all medical staff, every department, every physician. You're in meetings constantly, board meetings, quality committees, budget planning. You barely see patients anymore, maybe one shift per month. You miss emergency medicine, the adrenaline, the immediate impact. Now you're pushing paper, fighting bureaucracy. But you're making hospital-wide change, better systems, better outcomes, reducing mortality, improving safety. That matters. A major medical error, wrong site surgery, the surgeon operated on the wrong leg. You investigate. You implement new verification protocols. The hospital gets sued, $20 million. You testify. You defend your physicians. You defend your protocols. The case settles. The surgeon loses his license. You lose sleep over it. You're making $450,000 a year. You're also on your second divorce. The job consumed everything again. Your kids barely know you. You missed their childhood. Soccer games, school plays, parent-teacher conferences, all of it. Level 9, the Retired Physician. 25 years in medicine. You retire at 57. Early retirement, burnout, health problems. You can't continue. There's a small ceremony. Your colleagues attend. You receive plaques, appreciation, recognition. You turn in your medical license, your DEA number, your hospital credentials, your identity as a doctor, gone. You try to relax, but you don't know how. You've been working 80-hour weeks for 30 years. You have PTSD from the traumas, the deaths, the suffering. You see them in your sleep, the patients you couldn't save, the 3-year-old who drowned, the gunshot victim who bled out, the overdose patient you pronounced dead. You finally seek real therapy, years of unprocessed trauma. You're diagnosed with depression, anxiety, and PTSD. You think about your career, the lives you saved, thousands, the diagnoses you made, the emergencies you managed. But you also think about the cost, 2 failed marriages, estranged children, your health, your mental well-being, your life. You gave everything to medicine. Medicine took everything. You're financially comfortable. You have money, you have time, but you don't have relationships. You don't have peace. And somewhere, a college student is taking organic chemistry. They're studying for the MCAT. They want to be a doctor. They're idealistic. They want to save lives, help people. They have no idea what they're signing up for. The debt, the hours, the burnout, the trauma, the marriages that fail, the children who grow up without you. But they'll learn. Everyone does.